Okay, sir, can go ahead.
Can go ahead.
Yes, sir.
Okay, thank you very much. So thank you, Mr. Purnachandra Rao, for your nice introduction. And I also thank the organizers for inviting me and to present a talk in your international conference sponsored by AICTE. Okay, so let me start the presentation. Okay, just let me confirm. Mr. Purnachandra, are you here?
Yes, sir. Yes, sir.
Can you hear? Okay,
Yes,
so
sir.
can I talk to you? Just in the middle, I will ask whether everything is fine or not.
Yes,
Is
sir.
it
Yes,
fine?
sir. Yes, sir.
Okay, so okay. Okay, so good morning, everyone. So today, myself, Dr. Srinivas Patro, currently working with University Kuala Lumpur Royal College of Medicine, Perak, and today I will be presenting a talk on blended learning, a new normal in post-COVID era. Okay, so I will try to make it bit interactive. Okay, so you have to join me in few platforms whenever I prompt you to make it more interactive and interesting. Okay. Okay, so let's start with this one. Can you see a QR code on the screen?
Yes, sir. Yes,
If you
sir.
can,
Yes, sir.
if you can
Yes,
see
sir.
the QR code on the screen, can you go to any browser and scan the QR code, or you can type this link in any browser to open Padlet.
Sir, have you stopped the screen, sir?
Okay, just wait.
Okay, sir.
I have posted a link in the chat box. Can you see?
Not yet, sir.
Not yet. Okay, no problem. Okay, at least now you can see the screen.
Yes, sir. Yes, sir. It's back, sir.
Okay. So is it possible for you all to take a QR code app and scan the QR code and enter into Padlet?
Okay, let us check, sir. Let us check, sir.
Okay. If someone can enter into the Padlet page, can you tell me? Yes.
Yes, sir. We are trying, sir. I will just let you know, sir. I will let you know. Sir.
Okay.
Yes, sir. We are in, sir. It's a blended
Okay.
learning.
So if you are in,
Yes, sir.
at the bottom there will be a plus sign. Can you click
Yes.
and can you click?
Yes, sir.
And you can write your name and maybe from which college you are, just to introduce yourself.
Yes, sir. Sir, shall I publish, sir?
Yes, you can publish.
Yes, sir.
Okay, very good. So like that, if others, if you can join me in Padlet.
Yes, sir.
So if you click that plus sign, you can also see that you can write something as well as you can upload your image or any video, any audio clip, any document. Okay, so for the time being, I want you to just let me know or let us know each other.
Yes, sir.
Okay, so just to let you know that this Padlet is a digital notice board or whiteboard, or you can say it is a bulletin board. Okay, but with multiple options where we can interact with our students and student can post their blogs or images or audio recordings or video recordings or screen recordings. Okay, so that to make it more interesting.
Yes, sir.
Okay, so
Sir, we have posted the link, sir.
okay.
I think just now in the
Okay,
chat box we have posted the link, sir.
sure. Okay, thank you very much. So okay, so let me come here later and let us continue the presentation. Okay, Mr. Ponchandar, can you see
Yes.
the slides?
Yes, sir. Yes, sir. It's
Okay.
visible, sir.
Okay, so let me start. So this will be the outline of my presentation. So I'll be briefly introducing you about blended learnings and its background. Then we will see an overview of different blended learning models. And specifically one of the blended learning model, flipped classroom, we will go into detail. And then because your conference is related to product development or drug development, so I have brought in some of the product development content into this presentation. So I will try to align with this talk and justify to the theme of the conference. And finally, we will just see some of the widely used tech tools which can be used for teaching and learning. Okay, so let's start. So there is a famous quote by Benjamin Franklin. He told that, "You tell me and I forget, but if you teach me, I may remember, but if you involve me, I will learn." Okay, so this is a very important quote, highlighting that simply telling, or also if you go ahead, step ahead and teach, that is not enough for the students. Okay, so if we want to impart a good learning environment and atmosphere, then we have to involve them into our teaching so that the teaching and learning will be more fruitful. Okay, how we can do it? There are different ways. One of the way is by adopting the blended learning approach. What is blended learning approach? So if you see a traditional classroom on one end of the spectrum and a classroom where a student is studying near a computer at the home, so the first case, it is characterized or called, it is traditional face-to-face learning, whereas the second case, it is called completely online learning. So blended learning falls somewhere in the middle. Okay, and this blended learning approach is undertaken to support and enhance students' learning. So to be simple. So let us see some of the definitions of blended learning. According to Oxford Dictionary, blended learning is a style of education in which students learn via electronic and online media, which we have seen on the other end of the spectrum, as well as traditional face-to-face teaching. According to teachthought.com, blended learning is an approach to learning that combines face-to-face and online. Okay, so this, in simple terms, this is a combination of face-to-face and online learning experience. Ideally, each of them, that is the online and offline component, will complement each other by using their respective strengths. So blended learning promotes students' control over the time at which they study and the place at which they study, and also the pace, okay, of their learning. At this juncture, let us also go through some of the associated terms which are coming in this field. Okay, normally you will see also blended learning will be used with hybrid learning. Okay, so though on the superficially both are same, but there is some difference. Okay, if we see blended learning, just I have mentioned that it is a mixture of face-to-face and online learning. Okay, by using all the digital technologies, especially the online tools and techniques. Okay, so this can take place at home as well as at class. Okay, but hybrid learning nowadays, post-pandemic state, some of the universities, what they do, they call half of the students to the class and half of the students will stay at home. Okay, so the teacher will stand in front of a laptop and will teach the students physically in the class as well as online via online mode to those students who are in their home. Okay, so this is called as a hybrid learning. Okay, hybrid. Okay, so and that type of teaching is synchronous. Okay, synchronous means at the same time it happens uh, at the both at the class as well as at the home. Okay, so that is synchronous learning. Okay, so if we adopt this blended learning approach, then definitely the student learning is enhanced, and this is being supported by a survey by Center for Digital Education. Okay, so according to this survey, they found that by adopting blended learning approach, the students' engagement increased to 69%. Student retention rate rose to 39%. Test scores improved by 28%. The grades also improved by 22%, whereas attendance also there is an improvement by 22%. Okay, so this type of studies tells that blended learning is a very effective model to enhance the learning process. Okay, so now by knowing what is blended learning, let us proceed to the overview of various blended learning approaches. Okay. In other words, they are also called as blended learning models. Okay, so there are many multiple models. Okay, so this is a classification, standard classification. Okay, so if we see this one, the traditional one, that is the traditional classroom, also called as brick and mortar model. Okay, brick and mortar. On the other hand, it is completely online. Okay, so brick and mortar, the traditional classroom, it involves simple traditional instruction, or nowadays what the teachers do, they use some of the technology, okay, in the class to just enhance the learning inside the class. Okay, that's all. So that is normally called as a technology rich instruction. Okay, where even a student also can involve bringing by their laptop or computer. The teacher can use the tab to enhance the learning, etc. But all these things, still this is called as the traditional, that is the brick and mortar. Whereas all the brick and mortar means where it is physical classes takes place, where the student comes to the class. Okay, on the other end, the online learning, it is completely online. Student need not come to the class. Okay, so here also there can be full-time online learning or just informal online learning. Okay, we'll not go into details. Okay, but if you mix this brick and mortar and online, then it will result in the blended learning. Okay, so this blended learning broadly classified into 4 types. One is the rotation model, flex model, a la carte model, and enriched virtual model. Okay, so just let us go briefly one by one. Rotation model. So as the name suggests, rotation means students will rotate from one station to another, okay, on a fixed schedule. So this is important here. In rotation model, the teacher will fix a schedule first of all, and they will create different stations, and the students will rotate from one station to another station. So out of all those stations, one of the station will be online. Okay, one of the station will be online, and rest of the stations can be a teacher-led small group instruction. Okay, the teacher will create a small group, and one group they will send to the online section, and the other group, the teacher may involve with them for a small group discussion, or can go for a collaborative group projects or individual tutoring. So one-to-one student and teacher discussion, or the teacher may give certain task to the student, and where the student will do the task by using the pencil and paper. So that is called as pencil and paper assignment. Okay, so let us just brief go into detail. So station rotation model, I have told you that the model is a fixed one. The schedule is fixed one. Okay, so here there will be different stations, and what is the idea of this one is that the students, suppose there is one student is there, he has to go to this station, then he has to go to the next station, later also to the third station. So every student has to repeat every station, then only the task is considered to be completed. Okay, out of all those stations, one of the station is the online learning station. Okay, so other stations may be decided by the teacher as per the requirement. Okay, and those stations may be which I have discussed in the earlier previous slide. Okay, so next is the lab rotation model. Lab rotation model is also a fixed schedule model. Okay, but here there will be only two stations. Okay, there will be one station, the physical class, where the teacher will give the initial instructions. Okay, then those students will move to a computer lab. Okay, to move a computer lab to do the assignment as per the instruction of the teacher. After doing those tasks, they will again come back to the classroom to have a final discussion. Okay, so this is called as a lab rotation model. Third one is the flipped classroom. Okay, so as the name suggests, the model flips the classroom. Okay, so what is flipping the classroom? If you see a traditional classroom, students will do a classwork. Okay, where the initial instructions, ideas are given, and then they will be given a task and they will go to home and do the homework. Okay, so this is traditional manner. So flipped means, as the name suggests, we will do the other way. You upload the contents and give the video lectures, everything to the students via online. So students will do the initial task at home. Okay, reading the lecture notes and watching the video and all the initial instructions, and then they will come to the classroom to do the activities, or indirectly that homework which was previously given to the students in a traditional manner. Now that homework they will come and do it in a classroom. Okay, the advantage is that while doing the homework, they can do it individually, they can do in a group. Okay, and as well as there is a teacher to supervise them. Okay, so this learning is considered to be a very effective learning. Finally, individual rotation model. Okay, so individual rotation model means the station rotation model, the teacher fixes few stations actually, but here and in the station rotation model, the teacher fixes a few rotations and where every student has to go to every station. But individual rotation, because different students have different learning modalities, so you might have seen that somebody is having auditory skills. Okay, different types of skills. So depending upon the skill possessed by a child, the teacher, what he will do, okay, so for these type of students, individual assignment is appropriate, so he will send to that section. For another group, they may be going to an online one. Another group, they will be sending to a collaborative work. Okay, so this is curated by the teacher based on the need of the student. Okay, but still they will be going to different stations. Okay, but not all the stations. The teacher will decide that for this student which station is more appropriate. Okay, so in that case it is called as individual rotation models. Okay, so these four are different types of rotation models. Okay, the other models are flexed models. So in the previous rotation models, most of the schedules are fixed. Okay, but here the schedules are not fixed. Here the schedules are fluid. Okay, here also same, according to the learning activities, according to the needs. Okay, so and here mostly the learning takes place online, via online learning only takes place, which is the backbone of flex type. Okay, the online. Okay, and teachers just provide support and instruction on a flexible as needed basis. Okay, while the students work through the course curriculum and the content. And this model gives the students a very high degree of control over their learning. Okay, so that's why, because it gives a high degree of control, so therefore it is called as a flex model. Okay, so if you see the figure also, there are different breakout room, small breakout room, large breakout rooms. Okay, and a social area where students can sit and also learn. There are collaborative rooms. There is a science lab. Okay, so different sections are there. So where the teacher will decide a schedule and then assign to a particular student. Then the next one is the a la carte model, where here also students take one or more online courses. Okay, so and the rest of the courses are face to face at school. Okay, so there, because if you know, suppose, sorry, if there are 6 into 3, 18 credits the student has to take, but the school has no provision of providing all the 6 courses. The school can provide only 5 courses, whereas the other course, the last course, is an elective course. This elective course cannot be offered by the school. Okay, so what, but the school can arrange it in such a manner that they can take that course via online mode, and but a teacher will be there to support that. Okay, to support the learning, where the student will be taking the entire course online only. Okay, so that is a la carte model. Finally, enriched virtual model. Okay, so this is also like a flipped classroom only, but for a flipped classroom, the student has to come to the school every day, or when I am referring school, college, university, all are same. Okay, so here the student will be coming to the class regularly in case of flipped classroom, but in case of enriched virtual model, the student comes once a while to have a discussion with the teacher. Okay, for a general discussion, but rest of the whole learning takes place via online only. Okay, so these are the different models. Okay, so apart from this, these are the commonly used models adopted by different countries, especially popular in US. Okay, but it is high time to embrace any of these models as per our requirement. Okay, and in this post-COVID era, we cannot follow the same traditional way of teaching. Okay, we have to change, we have to adapt to the changes. The children's necessity is changing daily. So in order to accommodate all those requirements, we have to redesign ourselves. Okay, and try to fit into that system. Okay, so to summarize all the models, so in the station rotation, we see that all the students cycle through each rotation. Lab rotation, the student go to a computer lab for an online learning. Flipped classroom, the primary content is delivered online, followed by teacher guided work and practice in person. Okay, individual, so students have an individualized playlist. They rotate or work with at least one component online. Flex model, it is an online delivery with in-person enrichment through small group discussions, group projects, or individual tutoring as needed. A la carte, this is, I told, this is completely entirely online only, but students come to the school or they will have an online tutor, okay, to just assist them. And finally, enriched model, so students are required to have in-person learning, but not frequently. Okay, so this is the summary, right? Okay, so now if you see the different models, all those models are not that much easy to adopt, because you need to enrich your facilities. Your classroom should be big. You should have different setups to create different stations. Okay, so difficult, but hopefully in the near future, most of the colleges and universities will be able to provide that. Okay, otherwise we cannot survive. Okay, but out of all those models, one of the simple model is flipped classroom. Okay, flipped classroom is simple, where we just make a video. Okay, so the flip. I have told you that flipped classroom traditionally we do the core content, the lecture in the class, and then the practice part in the home. Okay, so this is traditional, whereas flip, it is the other way. Okay, so if you see, this is a popular pyramid. This is called as Bloom's taxonomy, the classification of various cognitive domains. Okay, starting from remembering, understanding, okay, all those things. These are called as lots, also called as lower order thinking skills, whereas the higher skills like uh, applying, analyzing, evaluating, creating, these are higher order thinking skills. Okay, so in a traditional classroom, the knowledge and understanding is provided at the class. Okay, so this is lots, and whereas the HOTS is achieved by doing the homeworks. So in flipped classroom, it is reverse. So the lots will be this is okay. So in the flipped classroom, the lower order thing, okay, is done at home. Okay, and then the classwork is HOTS. Okay. Okay, so what I thought is to bring in a component of the product development into this section. So normally in our practicals, we do a product development, that is the formulation development. Okay, so I have created a flipped classroom model into this practical. Okay, so where I will be giving a tutorial. This tutorial is given as a video section to the students, so they will go through this tutorial and get familiarized with the core content, and then they will come to the class. After coming to the class, we will be going for a discussion, and then we will be conducting the practical. Okay, so I'm just sharing the practical. Hope this will be useful to all of you. Okay, so this is a sterile formulation development practical, but this concept can be also applied to non-sterile dosage forms, like maybe liquids, solutions, emulsions, or a semi-solid dosage form. Okay, so this is a small video which I give to the student. Okay, so let us go through the video. Let us see what it has. Okay, so this is the video which we will be sending to the students before they come to the practical class. And then once they come to the class, we will discuss and come up with a formula. Okay, so just to confirm, Mr. Purnachandra, can you hear me?
Yes, sir. Yes, sir.
Okay, okay. So I am just ending the slide so here, and I'm going to another presentation.
Yes, sir. You can proceed, sir.
Okay. Okay, Mr. Purnachandra, can you see the slide now?
Yes, sir. It is visible, sir.
It is showing the outline and sterile product formulation development.
Yes, sir. Yes, sir. Very much same,
Okay.
sir.
Okay. So then the students will come, and this is the practical class where we will be giving the question that prepare 60 times 1 into 1 ml ampules of thiamine injection BP containing 25 mg of thiamine hydrochloride. Okay, so the students have to prepare 6 ampules. Okay, 6 ampules, each containing 1 ml, containing the thiamine hydrochloride drug. Okay, and each should contain 25 mg per ml of thiamine hydrochloride. This is the question given, and then they have to come up with a formula first of all. So if you make a working formula table, so that means only given thing is that thiamine hydrochloride. No other ingredients are mentioned, and we have to use the information which is presented in the tutorial video to come up with the formula. Okay, so let us see how systematically we can come. Okay, so actually in our classroom, normally this is the classroom from my previous university. This is called the X-Space Collaborative Classroom, where there are different stations. If you see here, there is one station here, another station here, another station here, another station. Okay, each station there are few chairs where few students can sit, and each of the station is connected with a television and a table. Okay, so where they can sit and have a discussion. They can come up with their either laptops or tabs. Okay, and they can have a discussion. So what I will do is that I will assign each group the same thing. So each group has to come up with the all these four things. Okay, one student will work on this one student will work on this one. Okay, and then after uh, after coming up with what active how much is needed, preservative which preservative and how much, tonicity adjuster which tonicity adjuster and how much, and finally the vehicle. Okay, so each will discuss, and then what I will do, I will call each any of the station and tell that you can talk on the one amount of thiamine hydrochloride needed, you can just present. Okay, so then they will present and other students can see in their respective screens, and then they will be having an opportunity to discuss. Okay, and once everything is done, then we will come up with a final formula, and we will then proceed to the aseptic lab for doing the practical. Okay, so just let us quickly come through these phases. So first of all, the excess and overage. So the question is prepare 6 into 1 ml ampoules. So we have to consider excess and overage. Excess, I told that for easy calculation, let us go for 50%. So if 6 ampoules means 6 into 1. Okay, so initially you need 6 ml. Then if you calculate 50% excess, so that will be 6 times 50% is, you will get around 9 ml. And then you also have to calculate, consider the addition of 10% overage, because if it is needed for single dose ampoules, because our ampoules are single dose, so we need to go for another 10%. So another 10% is 0.9 ml. So total will be 9.9 ml. Okay, so it will be around 10 ml. You have to prepare. Okay, so this is the calculation. So first row we come to know that what is the amount of thiamine hydrochloride needed. Then we have to see what is the method of sterilization. So for that we have to do some literature search. Okay, so in our laboratory we provide reference books like British Pharmacopoeia, Martindale, Pharmaceutical Codex, etc. So where they can refer the various monographs. So if you see thiamine hydrochloride injection BP, in the definition it is mentioned that the solution is sterilized by filtration. So they have to get this clue. They have to get this clue that the method of sterilization from the BP. Okay, so therefore this is done. Then so method is sterilization and sterilization by filtration. And if it is sterilization by filtration, we have to make sure that the filter which you use should be 0.22 micron filter. Okay, other filters are available like 0.45 micron, but that cannot remove all the bacteria. Okay, so these type of filters is just used for clarification, only to remove all the particulate matters. Okay, then preservative, whether it is required or not. Yes, it is required, because from the video if we see that anything which is sterilized by filtration, we must add a preservative. So therefore preservative. And from the list which I have shown initially, I have told that the most widely used preservative is 0.1% chlorocresol. So this one you can use, but you have to make sure that you check the compatibility of this preservative with the drug thiamine hydrochloride. Okay, we have checked and it is found to be compatible, so we can use 0.1% chlorocresol. Okay, other preservatives also can be used, but anyway we have to make sure that these preservatives are compatible. Okay, then we have to see that whether tonicity adjustment is needed or not. Okay, so again the requirement is that if you see the monograph, it is written that thiamine hydrochloride is injected by subcutaneous or intramuscular route. Okay, and if it is given by any of these routes, then the tonicity adjustment is needed. Okay, so therefore, because it is IM, so we have to go for tonicity adjustment. And how much of what to use? The popular one is sodium chloride. So you can use sodium chloride, and how much? So I have told you the formula 0.52 minus A over B, the freezing point depression formula. This formula you can use to calculate. Okay, 0.52 minus A. A is the freezing point depression of the drug. The value for 1% is this much, and the strength is 2.5%. So you have to multiply the 2.5 by the strength, 1% strength, by the freezing point depression of sodium chloride. This is 1% sodium chloride. Okay, so you will get 0.3% weight by volume. 0.3% means 3 mg per ml. So because we know that 1% is 10 mg per ml, so 3% means 3 mg per ml. Okay, so this is per ml. So our volume is, we have to prepare for 10 ml, so you have to go for 30 milligram. Okay, so now we come up with a formula. So thiamine hydrochloride is because we need 25 mg per ml. Okay, so when you are preparing 10 ml, it should be 250 mg. Then sodium chloride, we have seen in the previous slide, it is 30 mg. And what the bigger, this is the injection, the vehicle should be water for injection, and we have to write 10 ml. So this is very important. This is the quantity sufficient. And the chlorocresol, I have told you that we have to use 0.1% chlorocresol, but because this is in a liquid form, so you have to take the double strength. You have to take the double strength. That is the 0.1% double is 0.2%. So, and you take half of the amount. And when you dilute it to 10 ml, this 0.2 will become 0.1. Okay. So this is a simple formula. But there may be some other additives also which are possible. For that I am not considering now, because due to the paucity of time. Okay, so once this is done, this is solution is ready, then we will send our students to the aseptic lab. So okay, before that also the labeling we have to see. Okay, so we teach the students that because they have to add 10% extra, so whatever you are adding, you mention. Okay, so therefore they have to mention that it is the label 6 times 1 times 1 ml 1.1 ml ampoules of thiamine hydrochloride, each containing 25 mg per ml of thiamine hydrochloride, and what excipients it is present, that also you have to mention. Though the strength is not mandatory, but still it is suggestible to include the strength. Okay, the route, as it is mentioned from the monograph in the pharmacopoeia, it is subcutaneous or intramuscular. Dose, it is a POM medicine. So this is the POM medicine, prescription medicine. So therefore you can write it is dose used as instructed. And you have to mention that if any remaining solution is there, it should be discarded. Protect from light, and batch number, because this is a filtered sterilization product. So therefore 6 months expiry date you can assign. Okay, and finally the name and address of the manufacturer. And also once the product is ready, we will send for a test for sterility. Okay, so we have to do the test for sterility. So therefore I have written here, you hold the sample for sterility test, and then only you have to release it. Okay. Okay, so this is our aseptic suite, where we have a clean room, and these are the different laminar airflow units. So where the students will do their basic work here, and then final filling and sealing inside the laminar airflow cabinet. Okay, and then they have to seal the ampoules, and then they have to submit it. Okay. Right. Okay, so again, give me certain time to go switch back to the presentation. Okay, okay, Mr. Purnachandar, can you see my slides?
Yes, sir. It is very much same, sir. The last slide aseptic suit is there, sir. Not
Oh,
yet
that
changed.
slide. Oh, not yet changed.
Yes,
Okay,
sir. Yes,
okay.
sir.
Okay, now
Yes, sir. It was back to
now
outline,
back.
sir. Tech
Okay,
tools.
back to outline tech tools for teaching and learning. Okay.
Yes, sir. Yes, sir. Yes, sir.
Okay, so that was briefly about the sterile product formulation development, which normally used in practicals. Okay, as I have told you, that is the basic format, and we can follow the same thing for other non-sterile products also. Okay, so now moving to the last section, that is the tech tools for teaching and learning. So actually, there are many tools available. Okay, so but the problem is that most of the tools are paid versions. We have to do the payment, but we can use with certain features are free. So like the Padlet, which I have told you, this Padlet view is also a paid version, but the initial 3 Padlets are free. So each we can confine to 3 Padlets, and we can go on deleting the used Padlets and using a new Padlet. Okay, like that we have to maintain. And then so before that, can you just open a browser and type join class point? Okay. Sorry. Class point, join class point. If you see join class point, then you will be prompted to enter a class code, and you enter the class code as 79936.
Sir,
Yes.
sir, we have to join through blended learning. Huh?
No, no. Is it class point? Have
Yes,
you
sir. Yes,
opened?
sir.
Okay, just you go open a browser, maybe Google, and just type join class point. If you can join, can you please tell me that yes, you can join? Then here my question is that which all tech tools you have used last year or before for your teaching?
Yes, sir. We are trying to join, sir. Yes, sir.
Okay, okay. And if you have joined, then you can just, because there will be some options, almost up to, I think 5 options will be there. You can just type what tech tools you are using, maybe for assessment, or what LMS you are using, or for your presentation, what you are using, or for a whiteboard, what you are using, which tech tool. If any 1, 2, 3, anything.
Yes, sir. Yes, sir.
Even at least you can write the PowerPoint also for you are using for presentations.
Sir, how we have to enter, sir, data?
Can't you click and type?
So let me, sir. Sir, it is disabled, sir. Not unable to type. We are
Is
unable
it?
to. Yes, sir.
Okay, just are you using the laptop or phone?
Phone, sir. Phone, sir.
Okay, let me
Shall we do
also
it on
try.
desktop, sir?
Okay, class code 79936 join. Oh, sorry. Okay, now I have enabled.
Yes, sir. Yes, sir. Yes, sir.
Okay, now you got a box to type.
Yes, sir. Yes, sir. Right, sir. Right, sir.
Okay. Sorry for that. You can write as many tools as you want. Okay, anyway, I will close the submission here.
Yes, sir. Yes, sir.
Okay, so this is a way of collecting the feedback. Okay, one of the feedback. Okay, so this is word cloud. This is called as word cloud. And if you see here, the more the responses will be of similar type, the font size increases, and that will give you the overall idea of the participants. Okay, so this facility you can use it from a class point. Okay, so this class point, you see here, this is the class point. Sorry, this is the class point at the bottom. This is the app. Okay, so this can be integrated into your PowerPoint. Okay, so this comes with various types of pens, highlighters, erasers, etc. And also a whiteboard is there. Okay, so a whiteboard is there. This whiteboard will start, and whatever you want, you can scribble it here. Okay, and then you can, when you go to the next slide, so it automatically saves. Okay. Okay, so these are the some of the whiteboards which are available. You can try. Okay, so the most common one is if you are using Teams will be having a whiteboard. Okay, but some other whiteboard, some other apps are there which can be used. Okay, so this whiteboard 5 is also a commonly used one. Other things, very popular ones are Miro, Mural, a web whiteboard, okay, or IPV annotator, okay, Liveboard, etc. And one of the popular one is My Whiteboard, which I have used in the tutorial, okay, the formulation development one. And these are certain presentation tools. Okay, the widely used ones are PowerPoint and Google Slides, but you can also use Prezi, which is a very interesting one, or Visme, or Powtoon. Okay, Powtoon is also very popular. Keynote can be used with those people who are having the MacBooks. And some interactive presentations you can make by using Nearpod and Peer Deck. Okay, and these are the various learning management systems. Okay, so the commonly used one is the Moodle, okay, or somebody using Edmodo, Google Classroom, okay, and this Blackboard, but this is a paid version, very expensive one. Schoology also we can use, okay. And these are the various assessment tools. Kahoot, quizzes, very common, or you can use Google Forms or Microsoft Forms, or you can go for a Mentimeter and a Socrative. And if you want to record your audio and make a podcast, the commonly used and freely available version is Audacity. And some other things are there you can use for Soundtrap, SoundCloud, or Podomatic, or Podbean, etc., or TalkShoe. Okay, so I think I want to have a small assessment, which is again same. Can you go to the class point and join with the same code and just answer the simple question? Have you ever used quizzes as an assessment tool? Okay, so there are total 5 participants. So 3 have responded yes, and 2 have not. Okay, so this is another way. So the class point has multiple options. Okay, so you can bring in word cloud or multiple choice, okay, or true or false, or also poll, anything. Okay, so I don't know, it is already 1 o'clock. Mr.
Sir,
Yeah, can we go for this quiz, or there is no time?
sir, how much time it takes, sir?
Sorry, I maybe okay, maybe it may take 10 minutes. Okay, okay, anyway, no problem. We'll just skip this one. This is a simple quiz to assess the knowledge which has been acquired from this presentation. Okay, so before ending, I wanted to get you familiar with this term used by Japanese called as kintsugi. Okay, the term is called as kintsugi. So what in Japan, what they do when the their pots are broken. So what they do, they join the pots and mend it by using gold. Okay, and then they reuse it. Okay, so they call this process as kintsugi. Okay, so this also we can apply to our life, that whenever there is some difficulty or disappointment, we should not get depressed or feel stress otherwise, but we have to use we have to make ourselves strong, and we have to mend ourselves in such a manner that though our imperfections are visible, but still we are bold and to face the world. Okay, so this is saying that in Japan, broken objects are often repaired with gold. So the flaw is seen as a unique uh, piece. Okay, and objects add to its beauty. Okay, so when the Japanese mend broken objects, they aggrandize the damage by filling the cracks with gold. Okay, and they believe that when something has when something has suffered the damage and has made history, it becomes more beautiful. Okay, so with this, so if we implement blended learning, so the teacher's role is getting changed. It is not, teacher is no more called as the sage on the stage, but nowadays teacher is just act as a facilitator and be the guide at their side. Okay, so with this, I thank you very much for the opportunity, and sorry I exceeded a bit of more time. Okay, so
No, sir.
thank you, Mr. Purnachandra and your organizers.
Yes, sir. Yes, sir.
Over
Absolutely
to
not,
you.
sir. Absolutely not. It's our pleasure to have you in this session for today, sir. Yes, a program has been planned, sir, through the schedule. So yes, a bit of 10 minutes, but it is worthy, sir. Worthy.
Okay, so that's all from my side. Over to you, Mr. Purnachandra.
Thank you, sir. It's a wonderful presentation. So if you
Thank
stop
you.
sharing, I'll just share it the certificate of appreciations.
Okay, so I have stopped sharing.
Just a small token of respect from our side, sir, for sharing
Thank
your
you.
valuable time with us.
Thank you very much for the certificate of appreciation and also for the opportunity given.
Thank you, sir. Thank you, sir. So good morning to all. Today we have our next speaker, Dr. Mahendran Shekhar, sir. Sir, good morning, sir.
Yeah, good morning. Good morning to everyone. Hello, can you hear me?
Yeah. Yes, sir. Yes, sir. It's clear.
Yes, sir.
So it's a pleasure to have our speaker, Dr. Mahendran Shekhar. Just I'll read the profile of our sir. He's an associate professor and head Department of Pharmaceutical Chemistry in University Kuala Lumpur Royal College of Medicine in Malaysia. Dr. Mahendran Shekhar received his bachelor's degree in pharmacy in 2004, followed by a master's degree in pharmaceutical chemistry in 2007, and he was granted a junior research fellowship from University Grants Commission of to pursue his PhD degree in pharmaceutical sciences during the period of 2008 to 2011 at JSS College of Pharmacy, Ooty in Tamil Nadu. He is currently working as Associate Professor and Head of Pharmaceutical Industry Chemistry Department at University Kuala Lumpur Royal College of Medicine, Perak, under the Faculty of Pharmacy and Health Sciences since 2012. He has received several prestigious awards at the national and international levels for his excellent contributions in academic and research activities. He received Ogera Pendidic Kemeller rank in 2018 during Hari Pendidic Mara 2018. He also received the Outstanding Researcher in Pharmaceutical Chemistry Award during the first annual Healthcare Meet 2018 organized by Venus International Foundation, Chennai, India. Dr. Mahendran Shekhar has also received the International Achievement Award 2018 from Education Expo TV Companies Rating System. His innovative products won the gold medal in 3 consecutive years at the International Invention, Innovation and Technology Exhibition and special awards in national and international level innovation competitions and exhibitions. 2 of his innovative products are patented in Malaysia. His innovative products secured Best Innovative Product Award in Defense, Security and Sustainability Exhibition 2017 organized by UPNM Malaysia and Most Promising Invention Award in Parentes 2018 organized by Management and Science University, Malaysia. His research is mainly in the field of drug discovery and development of natural products. He is also interested in the development of innovative natural products using green technology. He has supervised more than 25 undergraduate final year students. He has more than 50 publications, including ISI and Scopus Index journals, proceedings, guidelines, and book chapters. He is also a reviewer with a number of scientific journals of international standing. We are very much pleased to have you, sir.
Yeah, good morning to everyone, and thank you very much to MC for the kind introduction. Can you please allow me to share my slide? Hello, can you see the slide, PowerPoint slide? Hello. Hello.
Yes, sir. Your slide is visible.
Okay, thank you. Okay, once again, I would like to take this opportunity to thank Professor Dr. Gopala Krishnamurthy sir, the principal, Bapatla College of Pharmacy, Andhra Pradesh, for the invitation to give presentation on this international conference on virtual tools in drug product development. So the topic which I was chosen for my presentation is current and future approaches in drug development from natural products. So why particularly I chosen this topic is because in pharmacy program, normally the lecturers and also the researchers, most of them, they are interested to do research on natural products. Why? Because natural products are always safe and toxic free, and also cheap in cost when compared to the modern medicines which are currently available in the market. So apart from that, the present methodologies which are currently we are following to develop a natural product into a market, so that are not significant actually. So that is the reason this presentation I was included the recent or latest technologies or methodologies that you can adopt or you can follow to develop a natural products into a next stage, which is clinical stage. Because currently, hello, can you hear me?
Yes, sir.
Yeah, I think some interruption. It's okay.
Yes,
So we need to use the
unmute.
okay, thank you. Okay, so we need to use the updated and recent technologies in natural product research to fast up the drug development process, because as you know, the drug discovery and development process is too long. It takes minimum of 10 to 15 years of time to come up with a new drug molecule. So, but nowadays the technology has been developed. So that is why your the conference team also, which is towards to virtual tools in drug discovery and development, something like that. So in my presentation, I was divided my presentation into two sections actually. So in the first section, what I'm going to present is what are the present methodologies and the future prospective to develop a natural products into a drug molecule. And the second section I was included about what we are currently focusing on in our laboratory in natural product as well. So I hope that this session will be very useful, especially for the young researchers, those are interested in doing research on natural products. Okay, so as you all know that natural products means which is comes from plant sources, but not only from the plant sources, it is mainly obtained from plant sources, but it also obtained from other natural sources, something like microorganism, animal sources, even also obtained from minerals. But most of them the currently available drugs, most of them mainly obtained from plant-based natural products, which have been commonly used for the medicines against various disorders, which including diabetes, cancer, brain disorders, and also cardiovascular related disorders. So if you look at the modern medicines still that are predominantly derived from herbs on the basis of traditional knowledge and practices, and if you look at the number of drugs which are currently available in the market, almost 30 to 40% of the drugs which are obtained from either from natural products or maybe derived from the natural products. Hello.
Sir, 1 minute, sir. 1 minute. Be online, sir.
అది పైన ఉంటుంది చేస్తా ఇదిగో చేసేసాను శోభా అది చేసా కానీ చూసుకోలే అసలు తప్పు చేసా ఏం చేస్తా ఎంత హడావిడి పడకుండా కాదు ఎంత హడావిడి పడకుండా
Sir, Mahendran, sir.
Yes, yes.
Sir, please unmute the all.
Sir, just I will end the session now and then I will restart, sir.
ఏం చేస్తాం
Okay.
Or else just be online, sir.
Yeah, no problem, no problem. I'll be in online now, no issue.
Sir, you carry on.
Yeah, I think now okay. Okay, so if you look at the advantages of natural medicine, why we are always looking for drugs from natural products? Because as you know, natural compounds used for the treatment of numerous diseases, which including cancer, diabetes, cardiovascular, inflammation, and also microbial diseases, even viral diseases, which including COVID-19. So this is due to the fact that natural medicines have distinct advantages, which including low toxicity or maybe the low side effect and low cost and also high therapeutic potential than compared to the modern medicines. So that is why we are always looking for medicines from natural source, especially from the medicinal plants. So if you look at how much effort that our researchers normally they put a lot of efforts to discover a new natural molecule to fight against various disorders, which I have been mentioned just now. But even though many institutions and centers support research programs that discover, design, develop, and test novel compounds for use as drug candidate therapeutics. So all over the world, I think many institutions and the funding agencies, they are ready to fund actually if you are interested to do develop or discover a new molecule, especially from the natural products, because they know the advantages of natural products. So how we can expand our effort, because our institution is supporting, funding agency is supporting, but still how we can expand to extend our research in natural products. So what we need to do as a researcher, we need to test large number of natural compounds for therapeutic effects. And also we need to discover a new way, new technology, new methodology to measure the effect of promising molecules. Because as we know, there are so many research has been done on natural products, and it has been proven that it is effective, it is low toxic, low cost, and everything. But why it is not into the, it is not available in the
Sorry
market?
for the interruption, sir.
Yes.
Sir, just a minute, sir. Actually, you have, that is the option have come for you as the host.
Is it visible, the slides?
Slide is visible, sir. Just a minute, sir.
Okay.
That is actually
Okay.
Srinivas Patra, sir. Srinivas, sir.
Hello, yes.
Sir, that is, you have got the host option, sir. If you don't mind, can you give the host option to Sudhir, sir, or Dr. M. Satish? That is Dr. Satish Kumar M is there, sir. You just make him the host and you will be the co-host.
How I can do it?
That is, you can go to the more options which are present beside
Yes,
your.
more. Okay,
Yeah,
more
then-
options.
Then that is Dr. Satish Kumar M is there, no, sir. You click on the more options for him and then you can make him host over there.
Sorry, if I click the more options, it is only showing that record on this computer, record to the cloud, stop live stream. That's all.
That is, you have to click on the participants list, sir,
Participants. Okay, participant list.
and then click on Dr. Satish Kumar M, sir. And in Dr. Satish Kumar M, you click on the more options which are visible over there, sir.
Okay, yes.
Then make him host, sir.
Make him co-host or host.
No, make him host itself, sir. Host.
Okay, I have done it. So,
Okay, sir. Thank you, sir. Okay, sir. Thank you, sir. You
Okay,
can carry
thank
on
you.
now, sir.
Hello, madam. Shall I continue? Hello. Hello. Can you hear me?
Dr. Mahendran, I can hear you.
Okay. Something
Yeah.
interruption. I think
Some
it's okay.
problem from that side, I think.
Okay. It's okay.
Okay, sir. Mahendran, sir, you can continue.
Okay. So as I mentioned that our institution or maybe the universities and funding agencies, they are very supportive and providing fund, especially to conduct research on natural products. So as a researchers, what we need to do exactly, we need to test large number of natural compounds for therapeutic effects. There are so many, plenty of compounds that has been isolated and structure has been identified, but not been developed or not been conducted many biological activities. What we do normally, the researchers, we normally search new plants, something new plant which is not been done anyone. So we conduct, we do extraction, then we do isolation, identify the compound, then that's all. After that, another person will come, they choose another new plant and they conduct a research on that one. Instead of doing that one, there are plenty of already isolated and structurally identified compounds are available. So we need to choose those compounds and conduct some biological activities. So that way, the process of drug discovery and development will be shortened. So apart from that, we also need to discover a new ways to measure the effect of promising molecules. Nowadays, the technology has been developed very widely. So there are so many and plenty of virtual techniques and methods are available to conduct the biological activities and so on. So, and apart from that, we also need to improve the design and efficiency as well. Okay. So if you look at the drug discovery and development process, every day almost 100,000 of molecules are tested and in experimental screening. But if you look at the cost of this screening is very expensive, and discovering a new drugs is becoming more complex and time consuming, because 10 to 15 years is something like a very long duration. And at the same time, you need to spend a lot of money. So that is why it is very expensive as well. So what we need to do as a researcher, we need to optimize all these steps of development of new drugs, especially drugs derived from the natural products. So medicinal plant drug discovery continues to provide new and important leads against various diseases, as I mentioned. So even in our laboratory, our groups, we normally isolate phytoconstituents and we do structural elucidation, then followed by we conduct some biological activities. And also we also developed some kind of formulations. But even though we do all this kind of work, the drug discovery from medicinal plants continues to provide an important source of new drug leads there are numerous challenges are encountered. Even though we start with isolated compound biological activities, we do formulation, but still there are some challenges which is in the natural product research. So that is the reason almost 40% of the development of compounds fails to reach into the market due to poor pharmaceutical properties. Even though the natural product might be having potential biological activities, low side effect, low cost in preparation and everything, but still there are some almost 40% of the developed compounds not available in the market due to poor pharmaceutical properties, which including all the physiochemical properties and ADME properties, which including poor solubility, permeability, and metabolic stability. So now currently what I'm going to present is, so what is the present method that we are using from the beginning to until the last step of natural product research, and what are the new technologies which are available, which you can adopt and or which you can follow to shorten the time of drug discovery and development process. So as you know, any natural product research always starts from selection of plant material. So how normally we select the plant material? We conduct normally the literature review. So or maybe based on the ethnomedical information or maybe the traditional information, we select a certain medicinal plant to conduct the research on natural products. So where we can get all this information? We need to obtain all this information from the reliable ethnomedical data and use in the traditional system. And previously means I'm telling about 5 years or 10 years before. If you want to conduct any kind of literature review, you need to go to library and search individual books like Indian medicinal plants, Materia Medica, and we need to go directly to the some of the forest or maybe village area to collect information, especially about the plant material. But nowadays, due to the technology, everything is available in online. All the books also available, all the informations are available in online. But at the same time, you need to follow or rely on certain information only. You should not rely on all the information which are currently available in the online. And another thing is collecting specimens from the correct genera and species used in the traditional system. That also very important, because sometimes the traditional system, they might be mentioned different species. Based on that one, you might be chosen the medicinal plant, but later when you come to know that the plant that you have been conducted research may be different. So you have to make sure that you have been collected the right species or selected the right species to conduct your natural product research. So after the collection, then authentication. Authentication is very, very important, because as I mentioned just now, you have to make sure that the plant which you collected is the right species or not. How you can come to know? So you need to get confirmation from the certified botanist. Okay. And previously, botanists, what they do normally, they have the kind of documentation about all the plant material. So they just normally they cross verify with your plant material, and they tell whether this is belongs to which plant species or something like that, and they may tell the botanical name of that particular plant. But nowadays, due to the technology, everything is computerized. Nowadays, even the botanists, I don't think they refer some kind of documentation, hard copies. Now everything is virtual screening. They have a kind of data, everything is in virtual platform. So normally they verify and they confirm whether you have been collected the right species, or maybe if you collected the wrong species also, they will tell exactly name of the species which you have been collected, okay, the plant name. So that way you can avoid the selection of wrong plant to conduct research. And after the selection, then authentication, then we normally go for basic operational techniques. So we need to pre-wash the plant material, because there might be some contaminants like soil materials may be present. We need to clean it. And after that, we need to dry the plant material by using freeze drying. And after the drying, then we need to grind the plant material by using some instrument. Previously, we normally use blender like a mixie, like that, to grind the plant material. But the disadvantage of that blender is you may not get the homogeneous sample material. The particle size are maybe different from one in another one. So that way, the extraction process may not be happened appropriately. So that is the reason nowadays we have the instrument, something like a grinder type, so that you can adapt to get the homogeneous sample. So that way you can increase the contact of sample surface and the solvent system, because the extraction process is very, very important, because your main aim is to extract the phytoconstituents which are present in the medicinal plant. So your the selection of method of extraction and the coarse particle plays a major role actually, because coarse particle and solvent when interact together, when the solvent enter into the surface of the pore surface of the plant material, then only the extraction process will be happened appropriately. So that is why even this is a very simple step, but still you need to follow the appropriate procedure, so that when you conduct the extraction, so you can that way you can extract all the phytoconstituents that are present in the plant material. So proper action must be taken to assure that potential active constituents are not lost, because that is very important, because your aim is to isolate all the phytoconstituents which are present in the plant material. So distorted or destroyed during the preparation of the extract from the plant sample, so that can be avoided. And next will be solvent selection for extraction. So normally you select solvents to isolate secondary metabolites. So secondary metabolites, if you want to isolate, you need to select normally the polar solvents, which are something like methanol, ethanol, or water. Those are polar solvents to isolate polar constituents. But at the same time, there are certain phytoconstituents like primary metabolites that also potentially active against active for many biological activities. So your solvent selection, my suggestion is you can select some solvent which is medium polar, which can isolate both polar and non-polar constituents. Okay. See, for example, even you can go for a combination of solvents, like you can use dichloromethane and methanol, 1:1 ratio. That is one of the best solvent to isolate both polar and non-polar phytoconstituents which are present in the plant material. Okay. Then after that, once you selected the solvent, then you need to select the method for extraction. So method of extraction also nowadays, so many methods are available. But currently what we are using, normally we go for maceration, either cold maceration or hot percolation, like Soxhlet apparatus extraction method. That are very olden methods. Nowadays, we have kind of instrument related methods, like even Soxhlet method. There is a sophisticated instrument which is having continuous hot percolation instrument, so which can continuously do the extraction, like same like Soxhlet, but it is automatic. But previously what we do, it is a manual one, it is a glassware type. Just we need to set up everything, we need to pack the plant material, then we need to conduct something like that. But now everything is automatic type is available. So that is why all the young researchers, even the institution, what I'm suggesting is we need to go for the new technology or the new methodology, so that our time will be reduced actually. Okay. And apart from that, you have so many other new methods like sonication method. You can go for shaker method, and you can go for accelerated solvent extraction method, steam distillation extraction method. So many plenty of methods, and we have everything nowadays instrument. Okay. Now previously we used to set up by using the glasswares. Okay. So we can adapt this one. And apart after the extraction process, we need to concentrate the extract by using rotary evaporator. And previously we use rotary evaporator without chiller. Okay, but nowadays the rotary evaporator is available with chiller. The advantages of with chiller is that can maintain the appropriate temperature in the water circulation, so that we may not lose any type of phytoconstituents which is low melting point, like 50 or 60 degrees Celsius. Sometimes when you use normal rotary evaporator, there is a chance to loss of those kind of phytoconstituents. But if you use additionally by chiller, that can be avoided. So after that concentration, we used to go for isolation and identification. So normally we use simple method like TLC or column chromatography we use for the isolation of phytoconstituents. But nowadays there is a flash column chromatography, this is called the flash column chromatography with virtual software. So this one, the manual work is totally reduced actually. So what the thing is, what you need to do, you need to pack the extract, you need to select the solvent system, that's all. So automatically the fraction will be collected, and according to the fraction collected, it is automatically cross-verify with the compounds which are already available in the database, so that you come to know which fraction you can, at least we can predict what type of compounds may be present in the each fraction. So this way you can adopt flash column chromatography. We have the traditional flash column chromatography without the visual monitor, but nowadays visual monitor with some compound libraries, so that it is easy for you to determine what type of phytoconstants may be present in the particular fractions. And another thing is, we normally use FTIR to determine the functional group, but nowadays we have the ATR, attenuated total reflectance, which can be used and facilitate the identification of phytoconstants. Because, for example, if you put one drop of extract, so that will tell that will give the infrared spectrum of that particular extract. So that can match with the database which is present in the libraries. So that can predict exactly what type of constituents that may be, and how much it is similar to the compounds which are already available in the libraries. Okay, for example, curcumin. So if you want to test some compounds, if, for example, if the curcumin is present, then that will say how much percentage that spectrum is matched with the curcumin which is already available in the library, so that you can easily identify, okay, the curcumin compound is present in that particular extract. So that way the technology has been developed. Okay, so this is the normal traditional method that what we normally, even currently, even some PhD students, they might be using column chromatography to isolate the phytoconstituents. So this is time consuming actually. It takes minimum of 3 months time to complete one extract actually. But if you use flash column chromatography, within few days, within 4 or 5 days, you can complete one extract. So that means you are minimizing the time, and that time, even though the separation is very good, and at the same time, you can monitor everything through the virtual platform, which is in the computer monitor, and that automatically cross-check with the compounds which are already established in the system. Okay. So after this isolation, then normally in the traditional method, we go for characterization of the isolated compound. So we normally do characterization by using UV visible spectroscopy, and infrared spectroscopy is mainly used for identification of the functional group, and NMR spectroscopy is mainly to determine the number of protons, number of carbons, types of protons. Okay, that one. Then finally, we confirm the molecular weight by using mass spectroscopy. This is the traditional method that we use for normal natural product research. And after that, what we do, once the compound is isolated, then we go for in vitro, in vivo studies. So in vitro studies, normally we use some kind of chemicals or maybe the cell lines to check whether your natural product is biologically active or not. Okay, once you conducted in vitro studies, then you select the potential compound or extract, then you conduct in vivo studies. Then based on the in vivo studies, you may separate the blood serum or maybe some of the organs which is in the animal model. So based on that, you come to know whether it is biologically active or not. This is the traditional method normally we use from the beginning until the end of the natural product research. So during that time, what are some challenges that we are facing, especially in the development of natural products? So normally many researchers, they normally tell the quantity of the isolated compound may be very less. Only that compound can be used to characterize, and we cannot further proceed for in vitro or in vivo studies. So my suggestion is, once you identify the structure of the isolated compound, you need to have a collaboration with the synthetic or medicinal chemist who can come up with the scheme how to synthesize a particular compound. Because even as I mentioned, almost 40 to 50% of the drugs which are currently available in the market originally comes from natural product. Every time we are not isolating from the medicinal plant, because our aim is we need to identify the constituents, the chemical structure. Once you identify the chemical structure, then you need to find the synthetic procedure, how to synthesize that particular compound. Then once you synthesize, you will get a large quantity. Then it is appropriate to conduct all the preclinical and clinical studies. And another technique to improve natural product compound development may involve the creation of natural product and natural product like libraries. That is why I'm telling, don't go for doing research on something new plant or new, you want to isolate a new compound and conduct the research. So there are plenty of already existing compounds, okay, which has been isolated by the researchers. The structure has been identified, and they might be mentioned that may be active against some of the diseases. But so those compounds you select and do and find the synthetic procedure, synthesize that particular compound and carry out the biological activities. So where you can get all this information, you can get it from the natural product libraries, where you can get the isolated compound chemical structure. And apart from that, another challenge is time. It is a natural product research is one of the time-consuming process actually. So how we can avoid this one? So we need to follow the new methodologies. As I mentioned, column chromatography. In the traditional method, column chromatography, if you want to complete one extract, you need to spend at least 3 months if you do continuously. Even if you're not doing continuously, it may take even 6 months to complete one extract. But if you use the fast chromatography with virtual, the computer monitor, with including the isolated compound libraries, you can complete the work within 1 week of time, and you can identify what may be the phytoconstants which are present in that. So that way you can reduce lots of time actually in the natural product research. And also you need to adopt with some innovative strategies to improve the process if needed. And another thing, another challenge is the acceptance of natural products, especially to the public or also from the researchers, are very, very less, because normally we need to answer certain questions when you bring the natural products into the market. So when you bring any natural product into the market, you need to prove that what may be the phytoconstants which are present in that, and what is the mechanism action behind that. What are the toxicology, whether that product is producing any toxic effect or not, and what may be the drug interaction. If you take the natural product along with something modern medicines, what may be the interactions. So those all need to be satisfactorily addressed. Then only you can bring those natural products into the market. And the biggest challenges in bioassay screening remain an important issue in the future of drug discovery from medicinal plants, because nowadays everything is very expensive. Even if you want to conduct a study on cell lines, or if you want to conduct some in vitro or in vivo studies, it is very, very expensive. Until otherwise, if you have a fund, then you can conduct research in an elaborative manner. If you don't have any fund, then very difficult to conduct biological activities. So that is the reason nowadays we have so many virtual related techniques are available to predict the biological activities before you proceed into in vitro or in vivo studies. So this is one of the method, as I mentioned here, it is in silico study, as you might be here. So the first step in the in silico studies is to confirm the significance of the plants, because mainly the isolated compounds mainly obtained from the plant material. So there are 3 types of plant material that you might be chosen for your research. One is the plant material which has been widely used and widely conducted many research. There might be proven what is the mechanism of action and everything. That is one type. The second type is it is a well-known plant material, but they may not be conducted much research, and the mechanism also may not be maybe unclear. And the third one is new utilization, helps with the history of traditional usage, but now with a new utilization. So these are the 3 different types of medicinal plants that normally we choose for any kind of research. So the second step in this in silico model is the organization and collection of natural products to construct the natural product database. So here the pre-treatment of these compounds, including drug likeness analysis, like drug likeness analysis means like physiochemical properties as per the Lipinski rule of 5, like you can check the molecular weight, whether it is below 500, and you can check the partition coefficient value, and you can check all the hydrogen bonding, donors, acceptors, rotatable bonds, everything. And also at the same time, you can also predict the ADME properties, including the toxicity and the exclusion of false positive things. Okay, because when you do the virtual screening, there is a chance to get some false positive result. So you need to revalidate again, and you need to confirm whether you are getting the appropriate results or not. And the third step is main core of in silico studies. So in this technique of this methodology, the in silico virtual screening, there are three different theoretical basis. The first one is virtual target fishing based on the pharmacophore searching. The second one, shape similarity validation, and third one is blocking accurate verification. Whether that particular compounds which are present in the plant material, whether that can bind and how far it is interact with the proteins or maybe enzymes that you have been selected. So based on that molecular interaction only, you can say whether that can produce any, whether that is biologically active or not, just a prediction. Then the final step is the analysis of set of targeted molecules. So here we can analyze the relationship of signaling pathways, pathological pathways, and related disease with potential targets. So finally, we can construct the network relationship among medicinal plants, natural products. So you can construct the relationship between the medicinal plants, which are originally that you are taken for the study, and what are the phytoconstants which are isolated from these particular medicinal plants, and what are the biological targets. So you can relate all these three. Okay, and we can also elucidate the mechanistic basis of the effect of natural compounds and medicinal plants to predict the potential pharmacological activities. This is mainly used one of the virtual screening where you can predict, you cannot confirm actually whether that particular compound producing biological activity or not, just a prediction. So, but this prediction has been proven by many researchers after conducting the in vitro and in vivo studies. So this is one of the recent available tool where you can predict the biological activities before you perform in vitro or in vivo studies. Okay. Here what you can do in the in silico, increase the number of database in order to reduce the number of biological tests, and use the drug ability loss like Lipinski profile, as just now I mentioned, and where you can get all the information related to pharmacokinetic and pharmacodynamic properties. You can also have a specific database for class of target and have a predictive binding modes of the molecules within the targets. So there are many researchers has been done already study on most of the diseases, which protein is belongs to which disease. So you can choose appropriately and you can predict the biological activities. And proper estimation of drug likeness properties. So whether because any molecules to become a drug-like molecule, there are certain properties are required, like lipophilicity, hydrophilicity, and the number of functional groups. These are very important for the biological activities. Because if any molecule, if it is soluble in the bloodstream, then only that can be reach the site of action, then you can get some kind of biological activities. Similarly, it is supposed to be lipophilic enough to cross the fat barriers, especially blood-brain barriers or some other fat barriers which are present in our body. And the functional group also plays a major role to make a hydrogen bonding, ionization, and everything. So this all plays a major role in the biological activities. So in silico studies will give some kind of idea exactly whether your particular isolated compound or maybe the structure that you have, whether that can adapt with all this Lipinski rule of 5 and also the drug likeness properties. And apart from in silico studies, I think in silico studies, I think some of them might be here, but metabolomics is something new for many people, especially for the young researchers, those are doing natural product research. So metabolomics is also mainly used for the identify the phytoconstituents or maybe the metabolites, which are whether it is toxic free metabolites or not. So metabolics has been defined as the comprehensive and quantitative analysis of all metabolites, which are comes from either from the after conducting the animal studies, either you need to separate the blood serum or maybe you need to collect the urine sample, and from that you can identify the metabolites which are present in that particular treated molecule, treated compounds, either maybe the isolated compound or maybe the means tested molecules which are present in the extract. So it is used to study about natural products, drug abilities, which including metabolites derived from natural products and metabolic changes induced by natural products. You can also predict the toxicity as well, because metabolites are totally related to the toxicity. Okay, so based on the metabolites, you can automatically predict whether your extract or maybe the isolated compound, whether it is producing any kind of toxic effect to the animals. And it is also one of the powerful technology for the investigation of xenobiotic induced toxicity, and you can predict the metabolism. So here what you use normally LCMS based metabolism. It is not necessary that you need to go for something new instrument to predict this metabolomic studies. LCMS is more than sufficient. So LCMS is mainly you can determine the molecular weight of the compound. So based on the molecular weight, there is a library which is containing all the molecular weight of some of the natural products, so that you can identify what may be the natural products that is converted into a metabolites. Okay. So the application of metabolomics should be broadened in the field of natural products in the future. So metabolomics has the potential to make a powerful impact in preclinical drug development studies. These are all preclinical. I'm not talking about anything about the clinical studies, where we can test the isolated compound in human models. But here, preclinical studies, which including the animal models. So where you can identify the new targets, either proteins or maybe the enzymes, and elucidation of the mechanism of action, you can predict. You can also develop the safety and efficacy profile of new drugs. So if you have the metabolites profile or metabolomics information, so you can come up with all this information. Even you can predict the ADME properties of the particular metabolites. So more importantly, toxicity can be determined by using based on the results which you obtain from the metabolomic studies. And this profiling has the potential to identify the toxicity early in the drug discovery process. Once you predict for example, when you do any kind of research, for example, it may be biologically active, potentially biologically active, some molecules. But later, when you conduct the toxicity studies, maybe very toxic, maybe. So what will happen? So after that, you cannot proceed further, because that is producing potential effect. At the same time, it is also producing high amount of toxic effect. So that way, whatever the time that you have been spent to develop that molecule, that has been wasted. So that is the reason, if you conduct the metabolomic studies, you can predict earlier the toxicity of that particular extract or maybe the isolated compound which has been tested against animal models. So this way, you can save time, money for pharmaceutical companies. And another important technique where you can adopt for the natural product is LCNMR and LCNMR-MS. So here you can analyze the crude extract of natural products and plant-derived compounds. And this technique is optimized for rapid identification of potential drug candidates. So this way also, maybe extract is containing different phytoconstituents. HPLC, maybe LCMS may be used to separate the phytoconstituents which are present. But at the same time, that can compare the database which is present in the libraries, and you can determine which is attached with NMR, where you can predict the number of protons, and accordingly that can cross-check with the database, and you can predict the phytoconstituents. So this way also you can predict the phytoconstituents instead of doing all the taking all the spectrum and do the manual structural characterization. And this is also one of the latest method which you can adopt in the natural product research. So detection of bulk drug impurities during the drug stability test, this also can be done by using LCNMR-MS. You can predict the drug impurities. So the data which you collect from LCMS or MS, which allow full characterization of all the impurities which are present in the tested molecule or maybe the tested extract. So these are all the latest technologies which you can adopt, apart from the techniques which normally we use currently in our laboratories. So what my suggestion to the young researchers or also to the dean or maybe the management people, please try to provide the facilities, especially to the students as well as to the researchers, all the new technologies, so that the time will be reduced for them to conduct the research. At the same time, they can get a predominant results when compared to the manual research. Because manually, if you conduct everything, it takes a lot of time. That is what we are doing, especially in India. Many institutions, they may not be offering the sophisticated instrument where you can conduct the process in a fast manner. That is why we are far behind in research when compared to some European countries, because they all have all the sophisticated instruments. They can conduct isolation process within a week or even one extract, and they can predict the compound within 1 or 2 weeks of time. But what we do with our technology, we just go for normal column chromatography, do isolation, then we send sample, get all the spectrum, then we need to spend some time for the elucidation and everything. That is very time consuming process. Okay, so even for example, the 1 year work which can be completed within a month actually, so that you can save lot of time if you use the technologies. So my suggestion to adapt with all the new technologies, new latest instruments, because nowadays everything we have the instrument, no need every manual work. Even the extraction also, as I mentioned, for the Stock-Select extraction method, we have the latest instrument which is not required any manual monitoring. So that will be automatically the extraction will be conducted. Only thing is you need to collect the extract, then you need to process with the next step. Apart from that, I would like to highlight something what we are doing in our laboratory. So normally the drug delivery also very important for the natural product research, because normally once you identify the phytoconstituents, you may conduct some biological activities. You might be identified it is potentially active, but at the same time, drug delivery is very important. So based on the drug delivery only, we can expect some kind of pharmacological action, because whatever the drug molecule that's supposed to reaches into the systemic circulation and site of action, so depends on the bioavailability and everything, we'll get the activity. So my suggestion is we should go for something we need to convert into a nanoparticles. So normally the isolated compound or maybe the extract, which might be having some phytoconstituents that are large in size actually. All the natural products, the compounds which are large in size. So there are some disadvantages, especially in vivo instability. For example, if you conduct any pharmacological study, maybe today with some extract, maybe the same extract, if you study again, maybe after 6 months or 1 year of time, you may not get the same activity. So that is called in vivo instability. We don't get the similar results continuously because of the larger size of natural products, and also natural product are sometimes unstable, especially when you conduct research on extract, and low bioavailability. Okay, the amount of drug, the natural product which reaches into the system and circulation, that also very low when compared to modern drugs, and poor solubility, lipophilicity and hydrophilicity, as I mentioned, poor solubility, that also one of the disadvantages of the natural product. And another disadvantage is poor absorption in the body, and problems with the target specific delivery. So you may be targeted maybe some organ, for example, brain, but if you prepare even natural product into a tablet form, for example, oral dosage form, that is supposed to reaches into the systemic circulation, then from there it's supposed to go to the site of action. So that takes longer time, and at the same time, the amount of drug which reaches into the site of action to the brain, for example, it will be very low actually. So that may be the reason the natural product has not been developed and it is not available in the market. So how to avoid this one, this kind of disadvantages? You can adopt with nanotechnology. Means you can convert your natural product into a nanoparticles, nano size, which is the size ranges from 1 to 100 nanometers. Okay, so this nanotechnology has been shown to bridge the gap between the biological and physical science by applying nanostructures and nanospaces to different fields of science. And previously, this technology has been used only by the engineering people 10 years or 15 years before. And nowadays, This has been adopted by the pharmaceutical sciences related researchers, and this has been given predominant results when you compare it with the general isolated compound. If you compare the results with the isolated compound and when it is converted into nanoparticles, the biological activity is better, and at the same time, the amount which reaches into the site of action also very high. So automatically, the bioavailability will be increased, the absorption will be increased. So all the disadvantages has been rectified when you convert your natural product into a nanoparticles. So what are the types of nanoparticles that you can adopt? So there are different types of nanoparticles, which including inorganic nanoparticles like you can adapt with the zinc, silica, calcium, zirconium, cesium, indium tin oxide. So these are all non-metallic origin, and especially these two are very commonly used material like iron oxide and silica nanoparticles has been mainly used or widely used, especially to convert the natural product into nanoparticles. And apart from that, these are some of the metals that you can use it, like platinum, copper, palladium, nickel, cobalt, silver, gold, aluminum, and manganese. And from this also, silver and gold nanoparticles are very commonly used by many researchers to convert natural products into nanoparticles. And especially silver nanoparticles they prefer, because gold nanoparticles is very expensive compared to the silver nanoparticles. So this way you can avoid all the disadvantages, as I mentioned, like drug delivery, including the bioavailability, drug absorption, the amount which reaches into the systemic circulation. So that all can be avoided when you convert into nanoparticles. So apart from this, I would like to highlight what currently we are doing in our laboratory. Actually, my research is mainly focused on neurodegenerative disorders. So what we normally adopt drug delivery of natural products in brain, especially for the neurodegenerative disorders. So as you know, neurodegenerative disorders is a general term for a range of neurological disorders which primarily affect neurons in the central nervous system that are characterized by the gradual loss of neurons in the central nervous system, so which leading to the defect in specific brain functions, including memory, movement, and also cognition level. So neurodegenerative disorders, which including Alzheimer's, Huntington, Parkinson's, and amyotrophical lateral sclerosis. So these are all the common neurodegenerative disorders that currently we are working in our laboratories. And how these natural products play a major role in neurodegeneration. I would like to give some just very little information. I might be included more information in my slide, but I do not want to explain everything in detail because the time is, I think, very minimum. Maybe I need to complete in another 10 minutes of time. So better I will go a little bit faster, especially some of the part which is not necessary that I need to give a brief explanation. So as you know, there are plenty of phytoconstituents which has been isolated, which has been characterized, the structure has been identified, and they have been determined the biological activity, especially it has been used for the treatment of neurodegenerative disorder. So here I was listed some of the flavonoid polyphenols, non-flavonoid polyphenols, phenolic acid. So I'm not going to explain everything in detail. So later, maybe if you would like to know, I can share my slide. You can come to know what are the phytoconstituents which are responsible for the neurodegenerative disorder. So also some alkaloids which are obtained from the plant material, isoquinone alkaloids, which including piperine, nicotine, caffeine. So there are plenty of compounds which has been isolated, characterized, and has been tested for the neurodegenerative disorders. But even though if it is identified as a potential compound, but still there is something lack to convert into a drug form, because the translation of promising preclinical neuroprotective research to clinical application has proven challenging. Okay, you have been identified, okay, this compound as potentially active against neurodegenerative disorder based on the in vivo studies. But at the same time, it might be having low bioavailability, limited solubility, physiochemical instability, and rapid metabolism. And another important thing is which may not be able to cross the blood-brain barrier, because we are discussing about the brain disorder. So the drug molecule supposed to reaches into the brain to give some kind of pharmacological action. So if your natural product is not able to cross the blood-brain barrier, then definitely there won't be a appropriate or maybe potential action which you have been expected. So these are all the challenges which we face after the development of preclinical studies. So how we can overcome all these issues? So you can use the nanotechnology and nanocarrier based approaches in the drug delivery of natural products, which may help to improve the therapeutic responses and enhance the effectiveness. So if you convert into a nanoparticle, that can easily enter into the particular site of action because of it is in nano size. And these are some of the examples which I given, the nanocarriers, which you can adopt, like carbon nanotube, liposomes, polymeric nanoparticle, lipid nanoparticles, micelle, and nanocapsule, dendrimers, nanogel. So these are all the latest methods, carrier methods, which you can adopt for the natural product to deliver into the site of action, especially for the brain disorders. So what are the advantages if you convert our natural product into the nanoparticles, which can enhance the neuroprotection activity? Because obviously, it will, once the compound is enter into the brain in large quantities, so automatically there will be a enhancement in the neuroprotection, and also increase the bioavailability, because the amount of drug which reaches into the site of action is very high, and improve the pharmacokinetic properties, and increase uptake and concentration in the brain, which also enhance the reverse memory and learning impairment, which also improve the stability and control the release. That also one of the advantages when you convert natural products into nanoparticles. So apart from that, drug delivery methods means you can convert into nanoparticles, and you can use nanocarrier as a drug delivery. And apart from that, one more very important step is the route of administration. That also play a major role. Once you convert it into a drug delivery, the route of administration very important. Especially for the brain disorder, you can choose. There are many route of administration, which including intravenous, intranasal, intracerebral, intrathecal, intraventricular, intraperitoneal, transcranial, oral route, ocular route. But among this route, I prefer normally, and in our currently in our laboratory, we are mainly focusing on intranasal delivery. So when you use the intranasal delivery, the amount of drug which reaches into the brain will be higher. So how I will tell, because normally any if you take the oral administration of any natural product or maybe the drug molecule, it is supposed to reaches into the systemic circulation and dissolve in the bloodstream. Then from there it goes to the site of action, which is brain, through crossing the blood-brain barrier. So instead of doing this one, if you use the nasal cavity, so normally this way, the drug molecule which reaches directly to the olfactory nerves, and from there it reaches to the olfactory bulb, then directly it reaches into the brain. So you are avoiding the drug which reaches into the systemic circulation, avoiding dissolve in the bloodstream and everything. So this way it is something like a shortcut. Directly you can whatever the amount of drug which entered into the nose, the same amount will reaches into the brain. That is the main advantages of nose to brain delivery, nasal delivery method. So this also our current focus. And if you use this nose to brain delivery, these are all the significant features or maybe the advantages. So you can reduce the dose because it directly reaches into the brain. So normally you can reduce the dose, the amount of drug which is applied to the nose, and minimizing the toxicity, because once the amount of drug is decreased, automatically minimizing the toxicity. And this also avoid first pass metabolism, and which is directly delivered to the brain, and bioavailability also enhanced, improved stability, enhancement of solubility, because it is directly passing through the olfactory nerve and dissolved in the nerves which is present in the nose. It is not going into the systemic circulation. So the enhancement of solubility and site specific and systemic delivery, because this is site specific, directly you are focusing on the brain, and fast onset of action. The action also very fast. means within few hours that it reaches into the brain, then immediately you can see the biological action. So my final word to all the young researchers, those are doing natural product research, and also to the researchers or maybe the academicians, don't choose some new plant or something like that, or you want to focus on something, you want to isolate a new compounds or something. There are so many compounds which are already has been isolated and available in the database or maybe in the libraries, natural product libraries. Choose those compounds. You just do the literature review, what type of activity that they have been done, because there are plenty of compounds not been established into the preclinical or clinical studies. So if it is not established those compounds, what is the aim or objective to isolate a new compound? It is not necessary actually. Still it is necessary, but my point of view is there are plenty of compounds are available. Do research on already isolated compound, well established compounds. So you can, if you do those compounds, then you can see those products definitely in the market in after some years, maybe 5 years or maybe 10 years of time. But if you do research on extract or maybe you want to isolate a new compound, that is never ending story only. You cannot bring or you cannot see that natural product in a drug form, especially in the market. So these are some of the examples which I given. And we are currently working on some of the natural products, especially on the isolated compound, well-established compound, not the new compound. And my final conclusion, natural products discovered from medicinal plants have provided numerous clinically used medicines. Even with all the challenges, we have so many challenges we face, especially in the natural product, but still, if you look at in the market, still people are looking for medicines from natural product. So that is the advantages of natural product research. So as you know, the technology has been developed. So we need to adapt with the new technologies, new methodologies, so that your time will be reduced in conducting certain part of your research. So that once your time is reduced, then automatically you can focus on further extension of your particular research. Okay, especially on the preclinical studies, or you can move into the clinical studies if it is appropriate. Okay. So in silico studies, you can adopt, that is one of the latest method where you can predict the biological activities. And metabolomics is also one of the very important method where you can predict the toxicity in the drug discovery process, where you can save your time and money. And another thing, as I mentioned, the efficacy of natural products are greatly improved when you convert into a nanoparticles or when you use the nano carriers to deliver that particular nanoparticles. So since 1990s, the FDA, Food and Drug Administration, approved nanotechnology-based products and clinical trials has strongly increased. And nowadays, I think you can see already there are some drugs are currently available in the market, which are made into nanoparticles. So use nanotechnology and nanocarrier-based approaches in the drug delivery of natural products may help and improve the pharmacological effect and increase the bioavailability as well. So as you know, natural products, there is no end for natural products. It is back to the future, and everyone is looking for the drug for especially for the treatment of the new diseases, especially like COVID-19. And we have seen plenty of diseases, something viral related diseases like Ebola, SARS, Nipah virus, everything. So everything we have as the solution in natural products. But the thing is, we need to adapt with the new technologies. Okay. So if you adapt with the new technologies, automatically the things will be faster, and then only you can see, especially those drug molecule in the market later. Otherwise, if you do just simply the extraction, normal isolation, and everything, the simple process, that is never ending story, as I mentioned. So you have to do, and another person will come, they select another new plant and do isolation. So that is not appropriate way as a researcher, especially as a pharmacist. So our main aim is whatever we do research, that is supposed to reach us into the public. So how that can be reached into the public? You need to convert into a drug-like molecule, or you need to convert appropriate to the drug delivery methods or something like that, or maybe you can go for something like innovative methods. Okay, So this way only you can discover a new molecule, especially from the natural products. So with that, I conclude my presentation. I would like to thank the organizer, the Bapatla College of Pharmacy, the principal, and Dr. Sajish Kumar, so for the special invitation. So I also mentioned my email ID and phone number, so that if you would like to have any kind of collaboration, or maybe or if you have any doubt in my presentation, or maybe in the this one conversion of nanoparticles, or you want to know more about nanomedicines, you can feel free to contact. Okay. So with that, thank you very much once again to everyone for listening my presentation. I will hand over the session to the organizer. Thank you very much.
Thank you, sir. Mahendran sir, thank you.
Yeah, thank you very much.
How
How are you, sir?
Fine, sir. It was an excellent presentation. As usual, you always mention that what is the end result of all this research activity, and you highlighted that yes, one way is to go for isolation of new compounds and its characterization. The other way is there are plenty of compounds already available in the market. Companies like Sigma Rich in Bangalore, starting with few mg to 5 grams, they are selling this isolated products for somewhere between 2,000 rupees to 10 to 15,000 rupees, which is very much affordable.
Okay.
And even in our lab also, we are for the past few years, for past 3 years at least, we have procured at least 10 to 15 different compounds from Sigma Rich. And it is very much related to your area only. We are mainly concentrating on Alzheimer's model.
Okay, that's good.
And one lesson which I have already learned from you is that not just doing a preclinical study, trying to make it into a formulation and to bring it to market.
Yeah. That is why we need to have a kind of a collaboration actually.
Yes,
if you are, for example, pharmaceutical chemistry person, normally they do all only chemistry related work. They don't go to the pharmaceutics or maybe pharmacology related work. So we need to extend our study with collaboration so that we can see something. The end result will be very good actually.
So in this regard, I request University Kuala Lumpur through you to support us for such collaborative activity where we can do some preclinical models.
Sure.
And we can do it in that way, and maybe compounds can be provided from your side. And when it comes to publication or other things, we can make a collaborative.
We can do all joint
research
publication, joint research. Yeah.
We have at least good number of facility for doing Alzheimer's disease research here, sir.
Okay, that's good.
And, so in that regard, I want to again emphasize that we learn from you, but we also looking forward for the collaboration.
Sure, sir, no problem.
And for the fellow participants also, whoever is in need of doing any Alzheimer's related projects, Bapatla College of Pharmacy is always there to do some collaborative projects. So not only for University Kuala Lumpur, but also for the other colleges in India also. Thank you very much, sir. It was always a complete presentation, and surprisingly, your colleague also has touched a new topic.
Yeah.
New topic in sense connected to the theme, and it was very happy to listen to you, sir.
Yeah, thank you very much for the invitation again.
Yeah. Now to Mr. Sudhir.
So thank you, sir. So we'll be having a small break for 15 minutes, and the participants can join back after 15 minutes.